to say it's fine if you want to record this, and Peter, if you want to record as well. It might be, if everybody's in agreement on the call, if everybody agrees, then it's fine. If there's one person that says, I don't want to do this, that's a different matter. So
okay.
I'm just checking to make sure that you're okay. I had a little trouble. I wanted to get in early to welcome you, Peter, but I think we'll get this smoother for tomorrow. But you can, and as you can see, you can run your own slides.
Yes, I shared earlier, so it was fine. But there's a small, very small thing. There's a little typo in the screen that says I don't know what NIADS is.
Oh dear. Yeah, I
Doesn't
see
matter,
that.
but if that comes up again, it should just be I think it's trying to be NIDA, but it should just be, I'm not NIDA. Fogarty.
I don't know where that comes from, so we'll make sure that's fixed. In fact,
Okay,
Marluce, can that be done now? Is Marluce on the call?
she is.
I'm here, Kate.
When I share the screen in a minute.
Yeah, because we wouldn't want that taped.
So I can unshare my
She's
screen, Mr. Kilmarx, and you can share your screen. Okay.
Very good.
And I can also record on my computer the session, but make sure you have also recording.
Great.
It's okay. Okay. Thank you.
Yeah. Good. 17. This is as many as we get in an in-person meeting. And I hope we'll get some more.
Just admitted 4 people.
Okay, I have 41 minutes past the hour, so it's our start time. We'll start in a minute. We're going to record the session, so if you please speak up now if you object to recording the session. So we will be recording. I'm Dr. Peter Kilmarx. I'm the Deputy Director of the Fogarty International Center at the U.S. National Institutes of Health. And I'm very happy. This is kicking off for me, participating in the Interest Conference 2020. And I'm going to talk about NIH grants in global health research, getting grants and funding from the U.S. National Institutes of Health. Let me start my record. Can I record individually?
Yes, I think you
I
can.
think down the bottom you could, where it says record.
Yeah, I'm not, when I'm sharing my screen, I don't see that. Anyway, as long as someone else is, oh, here we go.
Maybe the Shock Logic team can record.
I've got it. Oh, I
also
need to
record.
ask the host for permission to record.
I don't have any message.
As long as you're recording, we're in good shape. Here we go. I'm Peter Kilmarx. I'm the Deputy Director of the Fogarty International Center at the U.S. National Institutes of Health. Welcome, everybody. I'm going to talk about NIH grants in global health research. I think I've got about 30 slides I'll aim to get through in 30 minutes or less, and have plenty of time for any questions and discussion. So first of all, just to introduce the U.S. National Institutes of Health. We're the largest funder of medical and health research in the world. Our mission here is in 2 parts. The first is about basic research, pursuit of fundamental knowledge. So this would be developing things like CRISPR-Cas and cryo-electron microscopy and more basic science work. And then the second part is the application of that knowledge to extend healthy life and reduce illness and disability. So sometimes you'll see NIH doing something that doesn't directly relate to a health outcome in the near future. And that's because of that first part of the mission where there's a basic science research mission. There are 27 different institutes and centers at the NIH. The picture there is of the director, Dr. Francis Collins, and you're probably familiar with the biggest The biggest institutes is the National Institute of Allergy and Infectious Diseases with Dr. Tony Fauci, the National Cancer Institute. These are billion-dollar institutes. And then, but basically most disease entities or organ systems have their own institute. We're here as the Fogarty International Center. And you can see in terms of the funding, I can have a prize for if you can find Fogarty. Here's cancer has about $6 billion and infectious disease has about $5 billion. And here's Fogarty with about $80 million. So you can see what the different relative budgets are. And the total, this is a couple years ago, the total is now about $40 billion, the annual NIH budget. Also relevant, important to understand about NIH is it's got two parts. There's an intramural research is about 11% of the budget. There's about 6,000 scientists. This is the clinical center, the largest hospital dedicated to research in the world. And then the extramural, most of the funding, about 81% of the budget is for extramural research. So this is funding researchers, scientists, training all over the US and all over the world, thousands of institutions, hundreds of thousands of scientists. So we're going to talk about the NIH application and funding process. I should be clear at the outset that most of the funding is to US researchers, and most of the international research is actually the NIH funds a US institution, and then they collaborate with and fund a foreign institution, and including in Africa. I'll mention later, there's many hundreds of collaborations in Africa. So it would be unlikely that someone on the call would independently apply and get NIH research, but I think it's still helpful to understand the process. And then some of the principles are relevant to any kind of research funding application. So the NIH funding process, it's a two-tier system. And there's about 1,000 funding opportunity announcements per year. There's tens of thousands of applications and over 20,000 reviewers. So these are non-NIH scientists that review the applications in thousands, a couple thousand meetings that go on every year. And this is really, this process is sort of the jewel in the crown of the NIH research process. It's a lot of attention to how this process takes place. And what happens is a researcher will send in a proposal. The scientific panel, these are non-NIH scientists, will review it and give it a score. There's an NIH program officer who really helps to oversee the process, works with the researchers, works with the scientific review panel. And then our advisory councils for each institute and center just do a double check to be sure that the process was working smoothly and say, yes, we agree with the scores and proceed. And then it's the institute director that makes the final decision. So it's a straightforward process, but it's a multi-part process, and we think gets the best outcomes in funding the strongest applications. So what they're looking at is the overall impact, the scientific impact. Is this funding this application, will it make a sustained, powerful influence on the research field? And they consider a number of criteria and give a separate score for each of the criteria, which I'll go through in the next several slides. So the review criteria for NIH funding are the significance, the investigators, the innovation, whether there's innovation, the approach, and the environment. These are the main criteria. And significance is really, does the project address an important problem or critical barrier to progress in the field? If the aims are achieved, will the scientific knowledge, technical capacity, or clinical practice be improved? So it's often not, will this actually, we're not USAID, it's not looking for how many people directly will be helped. It's really focusing on the science. We're a research mission. And so it's really the scientific significance is paramount. The next review criterion is about the investigators. It's really, are these the right people to do this? Is someone saying they want to do some research, but they don't have the background or the expertise in that area? Or if they're trainees, is this the right kind of training in their level of their career? The next is looking for innovation. It's important to replicate research findings, but it's really important to be innovative. So if an application is proposing an innovative research approach, that's going to get a stronger score in this area. Is it going to really move the field forward in terms of the scientific methodology is also considered important. And then the approach is if they do what they say they're going to do, are they going to answer the question? Is it a reasonable strategy, methodology, analyses to actually accomplish what the aims of the project is? If what they plan to do isn't going to answer the question they say they're going to answer, they're not going to get a good score in terms of this criterion, the approach. Also part of the approach, there needs to be the protection of human subjects. There needs to be appropriate language plans around including minorities, members of both sexes and genders. For a long time, US research was mainly of older white men. And so there's more attention now to making sure that there's appropriate diversity in the research proposals. And then the environment, the research environment is, are they proposing to do the research in an institution where they've got all of the research support, the ethical review, the equipment, the safety? Is it an appropriate research environment for this to take place? And then there's additional criteria listed here, appropriate steps for protection of human subjects, inclusion of women, minorities, and children, and other additional review criteria. So important why applications fail, if the proposal lacks significance, if it's really not going to move science forward, if there's not an understandable rationale, if the application doesn't reflect a knowledge base of the scientific issue, there's lack of experience that's unfocused, there's interdependence of aims. So they say, I'm going to do A, B, C, and D, but they can't do D if A fails. And so it's not really a logical, successful plan. It could be too ambitious. You're going to, with your small application, you're going to cure all cancers. They understand that's not going to be possible. And it has to have a clear outcome and future direction. It has to make a lot of sense and really move the field forward, ideally. And so on the right side of the screen, some of the ways to build a convincing case, convey enthusiasm, be clear and compelling logic, think about what the possible roadblocks would be and how those would be addressed. Look at value for money, what will come out of it in terms of the investment. Make the application reviewer friendly, make it easy to find the different parts. The acronyms need to make sense and be standardized, etc. Have a thick skin and don't give up easily. The success rate is often 10% or even lower. So most applications aren't successful on their first try. So it takes multiple attempts. I'm going to shift now and talk about the global research that NIH is engaged in. So Dr. Francis Collins, our director since 2009, he's a geneticist. He started the Human Genome Project. And when he became the director and was asked about his priorities, it was a surprise to some that he said he was going to prioritize global health, research into diseases affecting the developing world. And a question would be, so why do that? Why would we pursue health research in around the world or in Africa in particular? And it's really primarily about the scientific opportunities. If there's unique populations, there's greater genetic diversity in Africa as the cradle of humanity than anywhere in the world. There can be unusual exposures and environment, infections particularly. If we're going to learn about Ebola vaccine, that research has to be done in Africa. There can be unique interventions, insights of different investigators, large patient populations, different health systems, and then the U.S. Early career trainees, scientists have a lot of interest in global health. So it's really, from the U.S. perspective, it's responding to the interests of Americans, that they want to engage in this. And I would say, just to add to this, in the current era of COVID, we need to have a lot more humility in the US about what we can learn from other countries, including from Africa, including from African countries. We had a webinar the other day about contact tracing in Africa, and with a US audience, to learn how to do contact tracing better from Africa in the US. There is a lot of international global research funded by the NIH. We're up to, last year, about 12,000 total extramural grants that had a foreign component. So this is a big increase over the years, as all regions have been trending upwards. Most of it is with high-income countries, but every region has had an increase over the last decade in terms of these extramural research collaborations. We did, this is with a postbac, Josh Grubbs, we did an analysis to see what percentage of NIH-funded research had a non-US co-author, and I thought it would be something like 20%. It turns out 35% of all publications that are funded by NIH have a non-US affiliated co-author. So it really is a global enterprise that over a third of US funded, NIH funded research has a non-US co-author. And remarkably, the publications that had both a US and a non-US co-author had a greater mean citation impact score than those that had US investigators only. So there's a lot of global collaboration going on, and those global collaborations have a higher impact than the US only studies, publications. So maybe not a surprise, but it's actually China that's the most represented in these international collaborations with the NIH, and mostly other high-income countries are part of the are the greatest numbers of collaborations. Among the low-income countries, we can see here, this is excluding China, but the ones with the most publications in this one in 2017, Brazil, India, there's South Africa, Egypt, and Uganda. So Africa is on the map in terms of our high value, high impact collaborations from NIH. Just as a map of sub-Saharan Africa, so this is the number of those extramural collaborations per country in Africa. You can see it's mostly East Africa and Southern Africa, with fewer in West Africa and very few in Central Africa, but over 1,600 total collaborations, NIH-funded collaborations in Africa. And then the countries that are most of this is going on, number one is South Africa, Uganda, Kenya, Malawi, Tanzania. Namibia is part of the other. It's there's not a lot of collaboration with Namibia, so we have room to expand that with our Namibian colleagues. And then in terms of which NIH institutes are involved in these collaborations, it's not a surprise. This is for Africa, the funding in Africa. Number one is infectious diseases, NIAID. Here's the Fogarty International Center, but it's also mental health, child health, cancer, heart, lung, and blood, the human genome research. So it's most NIH institutes that have some funding collaborations in Africa. And then just to talk about the Fogarty International Center, our mission, we have also kind of a two-part mission that we support all of the NIH, all of the other institutes in their global collaborations and partnerships. We're sort of the Office of Global Affairs for the NIH, but then with our own resources, we focus on training and capacity building in low and middle income countries. So that's really our main focus is on the training. And what we've learned over decades of doing this about building a global health research workforce is we have to have well-trained individuals. We really focus on the people. They have to have protected time to conduct research. And then ideally they have strong mentorship and have both US mentors with experience working in low and middle income countries and from investigators from those countries. Having that mentorship is so important. And if you follow over the course of a research career, we have, whoops, somebody needs to mute. We have these training and career awards, which I'll talk a little bit more about these, but earlier in the career, it's focusing on training people to be able to do research. And then later in one's career, then one goes on to actually apply for or to be as part of a collaboration for these research awards. So the RO1 you may hear about is the usual well-funded research award from the NIH. From Fogarty, we've trained thousands of people. Our training has really been for over 30 years where we've focused on this. So many of the leading public health leaders and researchers around the world have had Fogarty training. There's about 400 ongoing research and training projects with about 100 different institutions. And it's really quite diverse. It's not, we used to think of tropical medicine and infectious diseases, but now it's much more diverse and includes non-communicable diseases, informatics, bioethics, implementation science, quite a diversity of areas. Just as one example, we have a global health program for fellows and scholars. This is funding for both US and LMIC students and postdocs and doctoral training. It's 1 year of support. It's very wide ranging. Just as one example, Dr. Oteng in Ghana studied how patient outcomes were changing because of the new emergency department that they developed. And I do want to make sure folks are aware of this, what we call K43, the Emerging Global Leader Award. This is only for LMIC scientists, only for those from developing countries, and it provides 3 to 5 years of support of mentored research and career development for those scientists who apply. So one would have to have a junior faculty position at an institution. Only those individuals and institutions can apply. This is not for Americans or high income countries, and they have to have both a US and an LMIC mentor. And the research takes place in the low and middle income country. And just an example here, Dr. Kumar developed a video intervention. She's doing a study of depression in pregnant Kenyan teens and looking at the additional stress of COVID-19. So she developed a video intervention with her K43. This is very popular and very competitive, but really nice for the individuals who get this funding. One more is the Africa Postdoctoral Training Initiative. We realize that we have thousands of international trainees at the NIH in the intramural program, but there were very few, a tiny fraction were from Africa. So we have now the Africa Postdoctoral Training Initiative, where we have 10 postdocs per fellow. They're spending 2 years at the NIH laboratory, and then they get 50% support for their time to focus on research for the next 2 years back at their Africa home institution. This is funded by NIH and the Gates Foundation and implemented by the African Academy of Sciences. Our first cohort is still here. They should have left, but they've been extended because of COVID. It's a diversity of people and a diversity of science. They're working in 7 different institutes and centers. Our second cohort is coming as soon as COVID is over, and our third cohort we'll be announcing. So keep in touch with us and look for that announcement if you're interested in this. I want to let you know about this resource world report. It's a research funding mapping tool. So it has both the directly funded grants and the indirectly funded collaborations. It's not just NIH, it's Gates, it's the MRC, it's Institut Pasteur, it's Wellcome, it's 12 different research funders. And it has 15,000 institutions in 195 countries, over 400,000 program records. So if you search just on Africa, there's over 3,000 records that you can see who's doing what where. If you want to know where's the HIV funding, there's over 1,900 records for that. If you want to know where's the malaria research getting done, that's there. Or even sickle cell, you can look and see where's the sickle cell research going on in Africa. So last slide, just want to thank everybody for tuning in. Encourage you to keep in touch with us at Fogarty. This is our mission, is to support global health research and support you in your research training or research activities. You can subscribe to our global health newsletter and importantly, our funding newsletter. So for example, to see when the African Postdoctoral Training Initiative announcement opens up, that will be in our funding newsletter. It's not just NIH, we also include funding information, funding announcements from other agencies, international and US agencies. So it's a good one-stop shopping for funding information. And then we're also on social media and you can follow us there. So I will stop sharing. I see now we're up to 25 participants, thanks to those who've joined us. I can take a look in the chat for any questions. And I don't see any. So anyone can enter a question or comment into the chat, or can just, I think we're a small enough group that if someone wants to just turn on their audio or audio and video and ask a question, they're welcome to do so. Does anyone, is anyone actually working on an NIH funded project and have experience with receiving NIH funding and want to comment or talk about that experience? And you can, unless you have bandwidth problems, you can turn on your camera. I'd rather look at your faces than your names.
I see one question from Hilda.
Yeah, great.
Is there a maximum age limit to who can apply for these grants? Hilda?
Okay.
Yes, there's Hilda.
Yeah, I'll answer that, and I see other questions I can answer from the chat. So, so we're actually very careful at NIH, and we don't want to be accused of ageism. So we would never say to someone, "You're too old." What we talk about is career stage. So we talk about early career researchers, and it's usually 5 years after getting your terminal degree. So if you've gotten your PhD, for the next 5 years, you're eligible for early career research support. But you have to look very carefully at each announcement. There's the criteria are going to be very clear. You can always, and these project officers, they're there to help you. You know, your success is their success. So if you have any questions, they're very responsive and helping to understand this. So for the African Postdoctoral Training Initiative, it's generally 5 years after one gets the terminal degree. We do make some exceptions. If you say, well, I got my PhD in 2010, but then I had a completely clinical job for the next 8 years, and I'd had no research time or experience, then we would make an exception and say, okay, now you're still eligible. Or if you say I got my PhD in 2014, but then I had a child and wasn't working for 5 years, and now I'm coming back into the workforce, that would be another kind of an exception. Does that answer your question?
Yes, it does. Because yeah, it does. Thank you.
And that's for early career and training programs. For just regular research grants, there's no limit. We've got Tony Fauci's 79 years old, so there's no upper limit on getting the research funding.
Okay.
So
Thank
another
you.
question here about whether from Joseph Baluku, if MDs are eligible. Yes, definitely MDs are eligible. I'm an MD, so where there's no bias against MDs. For a lot of the programs, there has to be a doctoral degree. And an MBBS is included, is considered a doctoral degree in our programs. There may be some exceptions, but it would be unusual, and it would be very clear for each kind of program what the exclusions or eligibility criteria are. And it's really a mix. There's a lot of the grantees are MDs, a lot of our institute directors are MDs, many are also PhDs, and many are both MD, PhD. Also, we have veterinarians, we have nurses, but there would have to be a doctoral degree for typically for a nurse applicant. There's one area it's a little bit tricky is for engineers, that typically an engineer terminal degree is a bachelor or master's degree. And there's a lot of engineering research support. So that's one area which is different. So I'm going to try to scroll up, and because I saw some earlier questions. That's not working very well. Okay, let me start at the bottom and work up then. Clarify if the funding has to go through a government institution or private or NGO. So for each funding opportunity announcement, there'll be a list of the kinds of institutions that are eligible, including some are only for US, but many, and we highlight these in our funding newsletter, foreign institutions are eligible. It's often a wide range of universities, of research, of private institutions, NGOs that are eligible. Businesses can be eligible. Generally, one has to have some affiliation. It can't just be an individual person, but we have, some people are, Peter Kilmarx Limited Liability Corporation and have their own one-person entity to be able to fund. But typically the vast majority are to universities, whether they're US or foreign universities, but it can be also private institutions and NGOs. And I did see more. Mental health research, yes, there are a lot of opportunities for mental health research. I showed that box, those squares and rectangles. The National Institute of Mental Health is actually very involved in funding research internationally and in Africa. A lot of it is related to HIV/AIDS. And so looking at mental health barriers and facilitators to HIV/AIDS prevention and testing and treatment. But it's broader than that. There's mental health research on providing care, schizophrenia care models in Africa. Actually, the friendship bench that was developed by Dixon Chibanda in Zimbabwe. He was a Fogarty grantee and is now getting NIMH funding. So big yes to mental health research. How to get research training. So there's so many different ways to get this. What I would suggest is to go to our website and to subscribe to our funding newsletter. Most of our training, so most of our research training, what we have, it's called D43 programs, where we will fund an institution to implement a training program. So like we're funding the University of Washington to collaborate with the University of Nairobi to have a HIV/AIDS research training program. and then they will have dozens of trainees. So it wouldn't be the individual trainee applying for the funding, it would be the trainer, the professor who gets the funding, and with those resources, he would train multiple people in that country. So it's typically not, we do have, I mentioned the K43, the Emerging Global Leaders Program, but that's a relatively small part of the research training support. It's mostly through these institutional awards, and they would have multiple trainees under that. And so another way to look at this is to go into World Report that I showed and just look in your country, in your city, who are the NIH grantees, who's getting funding, and to reach out to them and see what they're doing. Do they have training positions available? And again, to subscribe to our newsletter and just to study as they come out what kind of support is available. Anyone want to share their own? Anyone who's had NIH funding or support who can add any insights? Gertrude, thanks for turning on your video. Where are you from? You're on mute.
I'm originally from Zimbabwe, but I live in Namibia now.
I see. What program are you working in?
I'm doing public health, master's in public health.
Okay.
But all along, I've been doing clinical work.
I see. Well, we have to get you into research.
That's what I want to do.
Okay. Yeah, there's not much. There's a lot going on in Zimbabwe. We have James Hakeem and others. We have a lot of research training in Zimbabwe. So you might have to go home to participate, or maybe through this conference we can get some more training and funding in Namibia. Yeah,
that would be nice. Thank you very much for the presentation.
Okay, I see another.
Hello.
Oh, thanks for the comment in the chat. Yes, Funku, Steve.
Yeah, thanks for the presentation. I have a question.
Go.
I would like to know, does the sponsorship, does it sponsor ongoing researches? Let me say, for example, if someone is doing a prospective study over a period of 5 years, is it possible to have a sponsorship midway when the research has already started?
I didn't quite understand. Can you say it again?
Okay, I'm asking if someone is doing a research which has to take probably kind of 5 years time, and he has to request for a grant midway, is it possible for him to receive the grant midway that the research has started?
I'm still not clear. The research grants are typically 5 years. We do have research planning grants, R21s, that are typically 2 years. So if you're just trying to get initial data, there's the R21 research planning grants, but the typical R01s and other research grants are 5 years long. So I think you're asking, can you get it midway through your research?
What I'm trying to ask is, if I have started a research with funds from different organizations, and
yes.
I want to probably increase the funds, or probably I need more funds to go on with my research, is it possible to apply for a research grant through Fogarty?
The simple answer is yes, but two things to add to that. I mean, in some ways that's an advantage. If you just come and you say, I've never done any research, I've got no data, give me funding, that's going to be very difficult. But if you can come in and say, look, I've already started this, here's my preliminary results. I've already got 500 participants and we've already shown this. And and I need additional funding to do this additional research. So, I mean, don't word it like we're funding someone else's program. Just say these are preliminary results, and here's my new, my extending this or my new research agenda. So that can be an advantage to have some data in your application. And then the second part is to be clear, as I showed you the bubbles in Fogarty, we've got a little bit of funding. For the most part, we do the training and then people kind of graduate and their research career is funded by another institute, whether it's infectious diseases or cancer or mental health. So if you're really focused on a research activity, we do have some research grants from Fogarty, but the vast majority of the international, including in Africa, research funding is from the other institutes. Where are you working? Where's your study?
I'm currently studying. I'm a master's student in transfusion medicine, and I'm affiliated with the organization Health Hero and Health Education and Research Organization in Cameroon. I'm from Cameroon.
Cameroon. Oh, okay. So there is a fair amount of funding of research activities in Cameroon. So I would, and again, it would be for the most part, there's relatively little NIH funding going directly to African institutions and investigators. It's mostly through a U.S. collaboration. So look on World Report and see who is getting funded in Cameroon, and talk to them about collaborating or working with them would be an approach I would recommend.
Thank you very much.
Yeah. Chidozie, did you have a question?
No, not exactly. I'm just pleased to have taken in a lot of details from your presentation, and then especially the fact that we could get look into the NIH grantees and then see who has gotten grants and then what they're working on, and then if it's in one's area of interest, then we can reach out.
Great. Where are you coming from?
From Nigeria. I think we have met before in interest of 2018, same session on grants. Yeah, so I work with human virology, Nigeria.
Okay, with University of Maryland?
Yes. Yeah. Yes. And
okay.
a colleague of mine has actually, gotten the Fogarty grant.
Okay.
Yeah.
Good. Well, I hope we'll see your application coming.
Yeah, I look forward to that too.
What are you focused on? What's your research?
The research is on adolescent HIV, basically to see how to transition adolescents living with HIV from the long-term pediatric care that they have been used to into adult clinic, which they find really chaotic and a difficult environment to cope with.
Yeah, that's certainly a big problem. And there's a lot of funding from the Mental Health Institute, from the Child Health Institute. That's definitely a important area and well supported.
Yeah, I'll look into that.
Okay.
Thank you. Nice to meet you.
Nice to see you again. Any other questions, comments? Anyone else have experience with working in getting funding applications, getting funding? Has anyone gotten their own successful funding grant, rather not from NIH, but from anywhere? Can we inspire each other with our success stories? Okay. Joseph. You're on mute.
Sorry for that. What I wanted to ask is that if I have acquired funding before, but if my supervisor got an NIH grant, and then they sort of sub-granted me to as part of that grant for my master's study or some other sort of sub-granting, does that count as part of a profile when I'm applying for an NIH grant? Can I say that I'm a beneficiary of a grant that was related to NIH in the past? I don't know if my question is clear.
Yes, I think that would be an advantage to say, that first of all, you've had whatever training and research experience came from that. So that's in your favor that you would be, more experienced. But then also that you have some familiarity with the funding, and a big part of it is actually the grants management process. What we found, so you may have heard about MEPI, the Medical Education Partnership Initiative, and that we funded. This is with PEPFAR funding from Fogarty, that we helped to develop medical education in 12 countries. And a big part of that was helping to build up their research support office, because a lot of times, we fund a US institution, they're doing all the grants management, and then just sending whatever funding is needed to the African institution. So it's a big step up for these African institutions to learn all of the NIH rules and regulations and the financial reporting and audits and all of that. So if we see an applicant that says, I have some familiarity with the NIH funding process and the rules and regulations, that's a positive. That would be a positive in an application.
Oh, thank you then.
Yeah. What were you working on? What was the research you were doing?
Yes, so we're looking at tuberculosis and HIV in Kampala slums in Uganda. And I think one of my supervisors got the training grant, and they gave us a small grant to conduct the study.
Okay. Well, then he would be a great, or she would be a great resource in, how were they successful and which grant did they get? And a lot of this, we have other sessions about mentorship, and it's really about finding someone. It's saying I want to be like that guy in 5 years. And so how do I get there, and asking what did they do, and how can you follow in their footsteps? That's what a lot of this is.
Thank you.
Well, anybody else? Anybody? I think we have another 10 minutes. Anybody working on COVID want to share their stories? I'm quite interested in that. I mentioned we had a webinar a couple of months ago on contact tracing, and we heard some great examples about contact tracing from Rwanda, from Nigeria, from Uganda, and from South Africa. Anybody in the COVID response want to share what they're doing? Has COVID affected people's ability to provide HIV care or conduct their research studies? Gertrude, what's happening in Namibia with COVID? Gertrude, are you able to continue the care, or is that getting disrupted? No, not answering. Well, Marla, shall we wrap things up?
Yes, if there's nobody who feels like asking anything, commenting on COVID in their country, on how it affects their jobs, sharing with your peers who are here, then one moment.
Hi, it's Bryony Chisholm here in South Africa.
Thanks,
Sorry,
Bryony.
my camera doesn't work, but just on your question on COVID,
Yes, please.
I'm doing my master's in medicine at the University of Cape Town, and yes, COVID very definitely affected my research, which was to assess the knowledge of patients of the interactions with dolutegravir. So my plan was to go out into the field, into rural Eastern Cape, Western Cape, and KZN, 3 of our provinces, and actually interview patients at rural clinics. And my first trip was planned for April, and we got locked down in March. So yeah, it changed my entire research project very rapidly into an online survey of healthcare workers in HIV and their knowledge of the dolutegravir interactions, which has been very interesting, and I've got great results. But it was very disappointing and a lot of lost work that had to be changed because of COVID.
Thanks. Yeah, that's great you were able to adapt. Was there any consideration of contacting the patients by phone and having remote?
We did consider it, but just logistically, it was virtually impossible. So yeah, we went with online, and I got a surprisingly good response from the online survey. So I was quite pleased with that.
Okay. Yeah, it's amazing how we're learning and adapting.
Yeah.
Including, this session, that when we have these meetings in person, I don't think we get this many people coming to a session. So this is good. Marlis, I don't know what the maximum was, over 25.
Yes, the maximum was 25, I think we just had here.
Okay.
Which is indeed much more than when it's a face-to-face, and it's very early.
How many are registered for the whole meeting?
All of you, right? Everybody's registered for the whole meeting, right?
No, but I mean, what's the total number of registrations?
Oh, it's already almost 700.
Okay. Oh, so that's typical.
Yeah.
All right.
But I think it's still higher than last year's, and there were like 904 abstracts submitted, which was really a record.
Okay.
So it's really exciting.
Bigger and better.
Yes.
Good. Here's a comment about interrupting ART care from Winnie. Winnie, how many patients do you think got lost to follow-up? What do you know, the number or percentage who were disrupted by COVID?
Hello, can you hear me? This
Yes.
is Winnie.
Hi, Winnie.
Hi. At my facility, we have 8,000 clients in HIV care, and we reported approximately 600 who got lost during the time of COVID. So we had to shift our clinicians from doing mainly clinical work in the office to going out to the communities to see how we can provide a comprehensive package, at the same time trying to improve and implement the infection prevention guidelines for COVID-19. So it was a bit of a new thing to do, a bit stressful, but there was a lot of learning in there.
Great, thanks. Okay. Well, thanks everybody. It's been great to see so many people and interact and hear about your questions and experiences. And just want to really encourage anyone to pursue research and research training. It's really a great intellectual and personal pursuit. So in addition to your clinical work and your other work, if you can have some experience engaged in research, it's very rewarding. And really, I was seeing with COVID how important it is. We don't have the tools that we need, whether it's to control HIV or malaria or COVID. We always need to learn and adapt and develop new interventions and new implementation plans. So we're big supporters of research and want to support everybody in getting the training that they need and support they need for a research career. And with that, we can wrap things up. Over and out. Thank you.
Thank you all also.
Thank you, everybody.
Thank
Thank
you.
you.
Thank you very much.
Thank you.
Okay. Move on. I do not know this.